Well, a week has passed since the last video that I made for you guys, and what a difference a week makes, right? Now it's the second week in June. The last week's video where we talked about CDC recommendations and the beginning of seeing patients here in Boston that were just dealing with COVID. Now we have to deal in Boston and different parts of the country with not only COVID-19, but also some protests and riots. It's obviously fair to say that protests are legal and it's a part of the constitutional, and it's everyone's right to protest, especially an important cause such as an end to discrimination. But I think we should all agree that there's really absolutely no excuse for looting a city, because first of all, business owners have had nothing to do with this, but if anything, these types of activities diminish and take away from the whole purpose of the demonstration. So we have National Guards here everywhere. We've got tanks going on now in Boston everywhere. So certainly a lot of changes as we have this Ferrari pass me by. Yeah, what am I on a scooter for? I should be driving that Ferrari. Anyway, so we're now in the second week and we've had a different phase having started of dentistry. People are actually, we're seeing still more patients, but overall in Massachusetts still, it seems like we're so far behind the rest of the country in terms of our response to this, or you could say maybe we're much more ahead by being far more protective. But either way, people are still just seeing emergencies for the most part, and there we go. Looks like as it's going to get busier, I'm going to end up getting killed more likely. So actually a couple of interesting patients today and yesterday, but just the ones today, I'm just going to talk 2 of the 4 emergencies that I saw today. One of them was a revision, was a patient that had a previous root canal in maxillary tooth number 3 and number 2. Both had previous root canals, apparently pretty old, through crowns. Both seem to be showing signs of leakage. And when we took the CT, you're looking at tooth number 3. The lesion was just in between tooth number 3 and tooth number 2's distal root and mesial root. And whenever I see something like this, you have to look at the overall chance of saving either tooth, and here number 3 is far more important. And it had one of these distal roots that was kind of ribbon shaped and was the distal buccal root and the palatal root were connecting. Now I didn't record this case, so I'm just going to quickly say what we did is we decided that we're going to save tooth number 3 and doing a revision on this tooth, and then decide and see if all the abscess goes away or number 2 is still involved afterwards. And then at that point, we'll have to make a decision whether number 2 is worth saving or should it just be extracted at this point. So what I did is just went back through the crown and revised that tooth with regular root canal therapy. As you can see, the pre-op CT was showing how the canals, the original root canal was done very nicely, but that was the typical Boston University look where you have a funnel with a very thin apical diameter and a very thick coronal diameter. And what you want to have is you want to make sure you have also adequate apical clearing and apical cleaning of the biofilm, and apparently in this particular case there was still some bacteria remaining, or probably from the leakage. But I went back in there and I just revised it by making sure that I increased the apical diameter to a much larger size. So I used the 40-04, I used the blend protocol. I went in there, removed the gutta percha, and then a long root like this, which is about 24 millimeters, took quite a while to take it, but we did the whole thing in one visit and then enlarged it, and we'll see how it goes. There's a chance that if we, because of the anatomy of that fused root, and I did find, by the way, an extra canal in that root, but you can't see in the post-op x-ray because it's superimposed and the patient wasn't interested in taking it out of the CT. We'll see if that doesn't work out, we'll probably do a apical on that too. But another case that I saw today was quite an interesting one. It's one of those rare cases that you don't often see in my kind of career, having done now 25,000 cases. cases. I have seen less than 20 of these types of cases. So this was a patient that had a tooth number 19, which is the lower left first molar. And as you can see, this patient didn't have a whole lot of other restorations, but this tooth ended up having a cavity that ended up getting a filling, and there was a tremendous amount of decay around this tooth originally, and the general dentist went inside the tooth and did a pulpotomy to get the patient out of pain, but the patient still had some pain following the pulpotomy, so he came back to see me to finish the root canal. Now, what's interesting about this tooth, as you can see, is obviously the tooth seems to be pretty normal looking at the regular periapical x-ray. Doesn't seem to have any type of anomaly in the root surface, but that's when we take the 3D image on the tooth. You can see as we are looking at it again from the sagittal section, it does look pretty normal. When we look at the axial section, you can see that the mesial root and both the distal root is very, very oval. And if you look actually at high magnification, you can see that there is, in fact, additional canals in this root. So you can look ahead of time here with the axial section on the 3D, and I can see that there are three possible canals in the mesials with a middle mesial, and there's also a possible middle distal canal present in this tooth with a possibility of having 6 canals that may have independent exits here. So what I did is I went in there and I kind of instrumented and found the canal. The key here is when you're doing your access preparation is to make sure you use the ultrasonic and give yourself adequate amount of opening so you can see in there. And at high magnification, I managed to find the extra canal that was present in the mesial and in the middle distal canals. And so use the endosequence blend protocol to go down on this case, and got to the end. And this was a modified blend protocol, which uses as the expediter the 2506. Now I'm actually gonna have a hands-on type of, actually a remote type of a webinar going on tomorrow, where I'm hoping to tonight stay up and edit this video and then be able to show the case video at the hands-on and the webinar tomorrow. But anyway, went down there and we finished it, 2506. 6 independent canals and hydraulic condensation, finished it up, and the final CBCT of this tooth. And this patient was an anesthesiologist, so she was actually very smart and interested in knowing how things go. And so we took a post-op CT to show her, and you can see in the post-op CT how 3 independent canals in the mesial and 3 independent canals in the distal roots were instrumented and then filled, and using 2506 and hydraulic condensation. Everything's been filled to the end. We have very good length control using the Endosig Plus, and everything is done in this case, and it's looking good. And you can see the 3D image of it. It's showing all those 6 canals filled. Looks like the Wolverine's arm when I was looking at it. All right, so that's it. This is just a couple of the cases that I did today. I wanted to share with you. I'm gonna go home. I'm gonna have to edit till late at night. I have also, actually in an hour, we have a webinar with some of the Real Endo faculties. We're gonna talk about how everybody's doing in their practice and so on. And then I gotta go and do all of the editing on this video, then go ahead and tomorrow I have another live webinar and so on and so forth. Anyway, so hope you guys are all doing well. As I said, a big difference a week makes. We had a crazy week here in Boston last night. Actually, my son and I were out scootering around town, and we got through these demonstrations and we were passing by, and it was kind of crazy to be in the middle of it. Again, for those of you young people out there interested in the cause, it's certainly okay to protest. It's a right, but I think everybody hopefully can keep cooler minds and be able to make sure that the whole cause is not obliterated by a bunch of looters that are certainly not interested in the cause, but rather creating chaos and anarchy. All right, let's not get political on this video. Hope you guys are doing well. Take care of yourselves, and I'll see you guys in the next video.